Peninsula Institute for Community Health, better known as PITCH, was founded by a group of citizens, concerned citizens in the southeast community of Newport News, who decided that we needed access for the residents of that area.
In the 60s, the city decided that they wanted to move away from the southeast community, so they moved the hospital, Riverside Hospital, up to its current location on Jake Hyde Morris, and then the health department soon followed. And Dr. Bryant was raising Cain that there was no place for the southeast community to have serious primary care.
Dr. Bryant was a well-known surgeon in the community who worked with the community leaders to make that decision, but we needed better access for the people in the East End community.
So they got together and they actually met in the basement, I believe, of a historically black hospital, Whitaker Memorial Hospital. They came up with the plan that they would start a health care center in Southeast Newport News. They sought the funding and received funding to open the first site, and that's the flagship site, and that's 48th Street Physicians.
I did what they used to call puff reviews, where every nonprofit had to submit their grants to the Health Systems Agency prior to submission to HEW. So at this one sub-area council meeting, I reviewed PITCH's grant, and afterwards, Dr. Bryant said, "Young lady, we are looking for a director for our health center, and you seem to know so much about health centers. Would you be interested in applying?" It was his vision. I mean, it was him that I saw that afternoon at the Y speaking about the need to have a health center in Southeast Virginia. He put up his practice as collateral for us to buy and build that building over there. So yeah, he had a lot invested in it. Our first operating space was 6,000 square feet. There was a pharmacy there. I made arrangements to have an ear, nose, and throat guy come once a week. We had 2 National Health Service Corps physicians, 1 National Health Service Corps nutritionist, 18 staff people, and maybe 2,000 patients.
There was an ad for a position for a clinical case manager to spearhead the pediatric program within the health center. And so I said, oh, this just seems like something that I can do. And so the relationship was born. It started, I got married, and I married Peninsula Institute for Community Health when it was one site. So I went there, started their pediatric program, started their baby care program with regards to our OB patients and providing case management services for them. And then we were small. We had the opportunity to begin to grow, and that's when I became the Chief Operating Officer. And I had the opportunity that I'm so thankful for to work with a wonderful person, my predecessor, Edwina Gary, who taught me everything about community, needs assessments, the importance of partnerships, sustaining those partnerships, and always seeing the bigger picture. I don't know what year it was, but she came to work one day and she told me, she said, "I'm not feeling well today." And so she said she was going to the doctor. A few hours later, I get a phone call, just like I'm talking to you. She said, "I'm on my way to Norfolk General Hospital." I said, "Oh, okay." She said, "I have to have open heart surgery." And so that was my moment. She said, "But I know you'll be okay."
I don't know where it came from, but it was my thought that whoever followed me should know everything that I knew. I was not one of those people who was scared that somebody's going to come and take my job. The day before everybody came here for our quarterly meeting, I was having a cardiac cath and being told that I had been scheduled for triple bypass the next morning, and nothing missed a beat. All
I kept remembering was, thank thank God for people like that. Because of her leadership style, I was able to manage the health center. She was always the grant writer for the organization, so we got a twofer. Not only did we have the CEO, we got the grant writer too. And so she has written the majority of the grants over the years. And so in her retirement years, we were able to continue that relationship. And today, she still writes grants for the organization. She's a beautiful writer, and she just makes all of your words come to life on the paper.
Initially, Peninsula Institute for Community Health is what we refer to ourselves as. Well, in our geographical location, we had actually spread. In Hampton Roads, everything is divided by a bridge. And so we actually, on the other side of the bridge or the other side of the tunnel, expanded into the south side area with some of our newer locations in Virginia Beach and Chesapeake and even in Suffolk. And so it got to be that we were no longer just on the peninsula, and we needed a name that better identified our geographical location, our geographical spread.
With community forums, our board of directors and staff, we became Southeastern Virginia Health System. And that's real because we are in Southeast Virginia and it encompasses that area. So to me, that name really was significant. It was certainly more reflective of who we are, who we've grown to be.
Now we have offices and locations as far as Matthews County, which is on the other side of Gloucester, all the way over to Franklin on the other side of Suffolk. And so we do have more than just the peninsula, more than just Hampton Roads area. We are pretty much spread across Southeastern Virginia, bridging all of those communities.
We opened our last site, Warwick Boulevard Physicians, and about 15 years ago, we purchased that land, a little over 1 acre. Thought we were going to build a women's health center, then something else came up and time went by. Fortunately, there came a health infrastructure grant, and so we had the opportunity to apply for that. We received $1 million, and then we decided we're going to build another building. That was my first opportunity to build from the ground up. Done a lot of renovation projects, but oh my goodness, to build that building from the ground up, it's beautiful.
Medicaid expansion came at the same time in the same year that we were building our newest facility. And so we're really excited about the opportunity and the things that are going to come with that. When I came to pitch in 1994, that was the only location, the one single location on Marshall Avenue. We had about 50 or less employees when I first came there. We have now grown to 15 sites with about 170 employees.
We celebrated 40 years of being in business, and I am fortunate to say that I've been there for 30. I've had the opportunity to see my center grow from being a mom and pop shop to a business. There are family practice physicians who see clients from birth on into their golden years. We have internal medicine specialists, OBGYN, behavioral health specialists on site in our offices. We also have support services. We have a health educator, we have a nutritionist, we have a pharmacy assistance person who helps you with getting medications that you might not otherwise be able to afford.
We have the 2 dental programs, we provide pediatric services, and then of course Brian White and Healthcare for the Homeless programs as well.
What we're working on now is infrastructure. Things change. We're going to take a deep dive this year into each site. What's the potential growth for this site? What do we need to add? Is this still relevant? I think we're there now, that we take a step back and we just start to look at our entire operation and what do we want to do next?